Hi, today my video is about a common misconceptions people have about a BP, hypertension. So just like a diabetes, this hypertension also a silent killer. Almost 1 in 4 Indians are suffering from hypertension. And many people have not known they have hypertension because they not checked it. So here is common 7 myths or misconceptions people have in their mind and finally end up in complications. We have seen many people in the clinic, they never check the BP, but when they come to clinic, the BP is already 170 or 180. And they suddenly come to emergency with some bleeding, with some complications. Some end up in a strokes, heart issues and all, and they lose their life. So this is the common misconception and clear what people have. The number one is I am feeling good. That means my baby may be normal. This is a common thing, especially most of the young people. Even people at around 30-40 years nowadays having diabetes and BP. But people think that I am feeling good, I have no issues, so automatically my BP must be normal. Why should I check a BP? So if you have a borderline high in the BP or mild stage 1 hypertension or in a stage 2 hypertension, you may not have any symptoms. So the symptoms sometimes when BP goes high, some people get a headache, like most probably in the back of the head, posterior headache. But it's not true that always one must have a posterior headache. Some people may get on and off headache. Some people may have some dizziness. These symptoms may not be there for every patient of BP. Some people I have seen in the clinic, they come with a BP of 190, 200 systolic. Absolutely they don't have any symptoms. Only because they come to clinic for some other issues, for a fever or a diabetes. When we check the BP as a part of vital checking, they come to know we have a BP. So make sure that check the BP periodically, even if you feel completely okay, because you should not miss and end up in complications. And nowadays, like the technology is improved, there are many electronic BP operators are available, like home run, brewer. These BP operators are relatively accurate, maybe some 10% variation from the mercury parameter and other things, but don't worry. You can check at your home. Suppose your home has some elderly people, diabetic, and along with them, you also check yourself periodically, at least once in a month, and so whenever it's possible to know the BP is normal or not. So this is one common myth. So even if you're fine, check your BP so that you can avoid many other complications in the future. Suppose if you check the BP, your BP is in the borderline, you can take some lifestyle changes and control the BP. And if you already BP has gone to the stage 2, stage 3, then you have to start medications. So many people with the BP don't have any symptoms. So don't believe that if you're okay, your BP is normal. Even if you're okay, BP can be abnormal. So this is the first myth. Second myth, only old people gets BP. It may be partly true that majority of the old people having more BP, but there are instances, there are many people, even young people also have a BP. Now even the people at 30s having high BP, and many people with young people with diabetics also have a high BP, and many people may having some other issues. So that is we call it a secondary hypertension. Somebody is having a renal artery stenosis and some hormonal issues in the body. That can give rise to a BP in the young. So there are many places, even young people also can get a BP. So don't believe that only old people get a BP. Whether if you are young, about 25 years, please check your BP. So don't think only old people get affected by complications of BP. Even young people also have, many young people have some sudden bleeding. They end up in a kidney problems because they not check the BP and they not notice their BP is really high. Third is, this is a very common misconception. I can stop my BP medication once it is normal. For example, somebody comes to my clinic with a BP of 150/90. I start some basic dose of medications. After 1 week or so, BP becomes normal. And many people think that why should I continue the BP medication? My BP is normal, can I stop it? So one thing you have to understand is your BP is normal because you're taking medication. Never make an attempt to suddenly stop the BP medication. Okay, take your advice of the doctor, and if the BP start coming low, gradually taper down the dose of BP medication with supervision, then stop it. So the doctor will tell you when to stop, when to taper it down. Suppose your BP is around 150/90, you started a medication, BP started coming to lower side like 100, 110 like that, and the lower one other things. Then instead of suddenly stopping the medication, gradually taper down the dosage with advice and you can stop. And in many cases, you may not stop the BP medications. Like for example, like a type 2 diabetes mellitus can be reversible in young people. But BP is multifactorial. Once BP is medication started, most people will continue. But with a lifestyle change, suppose a person get a good diet practices, healthy lifestyle, and he has reduced his weight, many cases we have stopped the BP. So like this, don't think that once we start it has to continue lifelong. Many cases we have stopped the BP medication, the good lifestyle change and reduction in the weight. And fourth is, and very common misconception, only salt is the culprit for the BP. Only salt will affect your BP. So that the common thing is reduce your salt intake. Any BP patient, reduce your salt intake. The thing you must understand is, more than the salt, what affects your BP is your sugar. So salt causes BP, that's already known. Sugar, suppose somebody consumes excess sugar in terms of a white rice, processed foods, rava, maida, this kind of stuffs. It causes a sodium insulin resistance. This insulin resistance causes sodium retention in the body. And this sodium retention can rise to high BP. So in our clinical practice, I have started many people, diabetic people on a low carb diet. So most of them had a BP and sugar both. Over a period of time, the low carb diet, they started losing the weight and the sugars coming down. Automatically the BP also comes down. So that means to say, this once you cut down the refined carbs and the sugars, BP will come down. So don't think there's only salt affect the BP. It is the sugars, refined carbs also affect the BP. So along with the salt reduction, also make sure that reduce your intake of refined carbs and the sugars. This is very important. The fifth misconception is, I don't need to check BP at home because this machine may not be accurate. I can only check BP at the hospitals. No. Now this technology is advanced, even this electronic BP operator is also relatively more accurate. Don't worry about this. 5-10% of differences doesn't make any difference. I suggest check your BP at home. This is more reliable because many people when they come to the hospitals or a clinic, they get some stress. And many people have BP high only in the hospitals. When they go home and check BP is normal. We call this as a white coat hypertension. So somebody I've seen that when they come to hospitals, the BP is 150, 160 and they say that, sir, when I never check the BP at home, BP is always normal. I feel check the BP at home only, that is more reliable. And while checking the BP at home, follow some instructions like, do not check your BP immediately after your coffee, tea, breakfast, lunch, and when you're in a completely stressful mode, after exercise and other things. Once you get up in the morning when relatively free or in between, you check the BP, sit comfortably over the chair and put your hand over the chair support or at the table support and keep your BP apparatus at the arm level and check your BP. And don't check immediately after eating exercise. That is very important. And while checking BP also, don't sit cross-legged, sit normally, sit comfortably, sit relaxed and check the BP. So home checking BP is more important than the BP checking at hospitals because it can, at home you are more relaxed. Sixth misconception is BP medication affects kidneys, addictive, and BP medications are harmful. Remember this, all the medication in the world have side effects. Not only BP medication, every BP medication comes with the side effects. Likewise, BP medication also has some side effects. So nobody can say that BP medications are very completely side effects. Because the benefit should outweigh the side effects. Suppose if your BP high, what happens if you don't take BP medications? It can lead to kidney issues, it can lead to stroke, it can lead to heart attacks, it can lead to vision loss, it can lead to bleeding somewhere. These are all catastrophic complications. But if you control the BP, some people may get some postural hypertension, some kind of dizziness, your potassium may high, something will happen. These side effects can be manageable with a proper supervision. And many BP medications are completely safe. Some BP medications have side effects that the doctor will advise you how to monitor them. And BP medications doesn't affect the kidneys because what BP medication doctor prescribe you are within the permissible limits so that it should not affect kidney. And remember, if you don't take BP medication, your kidney gets more spoiled early. So don't think that if you take BP medication, your kidney is spoiled. Taking BP medication with the advice is good, or whatever the medications the doctors give within the permissible limits. The last is natural remedies will cure BP. So people tell that eating 1 clove of garlic every day will do good for my heart health, good for BP and other things. But don't rely only on that. Take a proper medication because you have continuously high BP. We don't know how long it will take for the garlic to act and how long it will take for some other supplement, herbal supplement to act. And don't rely on that. Maybe I'm not telling you should not use garlic. You take BP medication, along with that you have 1 clove of garlic every day. It has so many other benefits. It will help you. But don't rely only on herbal remedies to the BP. So your blood pressure should be under normal limits. The blood pressure is not under normal limits. It affects many organs in the body. So avoid that, take BP medication. Along with that, if you believe some home remedies, herbal remedies, take it with a caution. And should not that, and taking too many things, taking BP medication, keeping herbal remedies, so many herbal remedies, all this will also affect your liver and kidneys. So be careful about it. So don't rely only on herbal remedies for the control of the BP. Take BP medication. There are some supplements which are really helpful for the control of BP. For example, magnesium. So magnesium is one supplement that relaxes the arteries and taken for a few months, it helps in controlling the BP. That's good. But when BP is high, you have to take BP medication. Along with that, you take magnesium supplement. And coenzyme Q. This is also one of the supplement which helps in heart health and good for the BP. But again, it's not the only remedy to be taken. It has to be taken along with the BP medications. And potassium-rich foods like salads, avocado, this is also good for BP control. These are always like supplements, like lifestyle changes. Those are not the only way to control your BP. Suppose your BP is just in the borderline, 140/90. So you're not on any medication. In that way, you focus on reducing the sugars, focus on reducing the weight. Take some of the supplements like magnesium and coenzyme Q with the doctor prescription. But when BP is already high, like stage 2, stage 3 hypertension, take the BP medications. Along with that, you can use this supplement. So these are the common things people have this thing. So BP is a very silent killer, and many people are having BP even at younger ages. Check at home periodically. Don't neglect it. And BP is silent killer. Like for example, sugars has its own complications, but high BP silently affects your kidneys, heart, your eyes, and many other organs. That's it.